Get ready to listen, learn, and earn CE hours. This podcast features content from an accredited CE activity provided by Calibri Healthcare. Visit elitelearning.com/podcasts for accreditation and disclosure statements and instructions on how you may be able to earn CE credits.
Could music therapy be a beneficial tool to add to your non-pharmaceutical interventions toolkit? Researchers are finding that music therapy has many benefits in the realm of health and healing, from reducing stress and promoting relaxation to reducing anxiety levels before surgery more effectively than prescription drugs. Music therapy has been used to treat pain and multiple mental disorders, from anxiety, depression, and post-traumatic stress disorder. It has also been proven effective in dementia, Parkinson's, Alzheimer's, and even autism. We're glad you are joining us for this series on music in health and healing, where we'll discuss how music is used in Western healthcare to promote physical and psychological healing and to improve quality of life in neurological conditions. Welcome to our podcast on music in health and healing. This is going to be a great topic for everyone. Our subject matter expert today is Dr. Margaret Carno, Professor of Clinical Nursing and Pediatrics at the University of Rochester School of Nursing in Rochester, New York. Welcome, Dr. Carno.
Thank you so much. I'm really excited about talking about health and music and healing.
Yes, I'm excited about this too. This is so intriguing to me. Now, this sounds like a silly question because we all have our own concepts. But what exactly is music, and what are the basic components of music?
Okay. So first, before we start talking about music, we really have to discuss what is sound. What sound is, something makes the air vibrate with a pressure wave. And then the particles keep vibrating and keep pushing other particles along until they hit our tympanic membrane. And the start of it could be the plucking of a string, the blowing in an instrument, our own vocal cords. So there's a whole bunch of different ways that these pressure waves can be started. And then how fast the pressure wave is what we call the frequency, which we measure in cycles per second. So they're called hertz. And those determine the pitch. So if it's faster, it is a higher sound than if it's lower.
Oh, okay.
And as humans, we really can only hear about between 20 and 20,000 hertz, with our best area of hearing between 200 and 5,000, 5,000 hertz.
Wow.
That's why they have dog whistles. Dogs hear differently than cats, than humans.
Right.
Now, as I said, the frequency is the pitch. The amount of energy is what we call decibels, and that's the loudness.
Okay.
So basic from starting with that is, when you think about music, we have rhythm. So, the beat, tone, which can be a steady sound, pitch, which we just talked about, the frequency, quality is called timbre or timbre, depending upon, and the way the notes, the rhythm, a melody is put together is what we call music. And really, all music is a collection of sounds in a time in a way that expresses feelings, ideas. There's color when you think about it, when you think about the different tones or different instruments that are used. It's used for communal practices, along with personal enjoyment.
Sure.
And we associate pitches and certain note phrases with certain feelings. So when you think about the sweeping orchestral pieces of any Harry Potter movie, for example.
Right.
Or those 2-note opening phrase of Jaws.
Oh, yeah.
or even the Rites of Spring. Those invoke feelings. And it's interesting, there's been a lot of information on music and health, healing, the biology of it. And the real thought is that music is the rhythmic driver, meaning that the rhythm helps the body to become synchronous. And this is how it helps with stress reduction and promotes empathy.
Oh, wow.
So it affects a wide range of things that we will talk about as we go through this podcast. And we have to remember, music is the one thing humans do that affects all the brain.
All the brain.
So, all the brain.
Wow. That's interesting. I didn't realize that was so effective. Let's talk about the physiology of that. So how does it affect the brain? And can you walk through how all those areas are? That'd be great.
Sure. So our frontal lobe really, when we think about it, we think about emotions and regulation. That's where music enhances the function. And we'll talk about that more in when we talk about traumatic brain injury.
Oh, good.
But
yeah.
Music enhances that, and our frontal lobe helps with the pleasure. Our temporal lobes, if it is song, the left interprets the words and the right interprets the sound.
Wow. That makes sense when you say it like that. I just never thought of it.
Broca's area is where we start feeling about the music. The Wernicke's area is how our brain analyzes and enjoys the music. Even the occipital lobe, some people can listen to music, close their eyes, and actually see the rhythm or the melody on their closed eyes. Or some musicians can actually see the notes.
Wow.
So it really... it increases dopamine in parts of the brain, similar to the levels that you get when you ingest cocaine. So we're talking real pleasure symptoms. It affects the amygdala. It controls pleasure. The hippocampus, it actually increases neurogenesis in the hippocampus to produce new neurons and improve memory. The hypothalamus, it acts right on that. That's where we get our decrease in blood pressure, increase in heart rate, or if it's fast music that revs us up, it can increase blood pressure and heart rate. And then, interestingly, it also increases dopamine at the putamen area, which is where our responses to rhythm is of the brain. And we'll talk about it a little more, but we can use music in patients with Parkinson's at a certain rhythm to help them walk, help their gait be better.
Wow, that's fascinating.
Be less at risk for falls. The problem with that, though, is we haven't been able to extend it longer than the time of listening to music.
Sure. Oh, wow.
But that is, a quick rundown of all the different areas where music affects the brain.
Wow, that's really impressive. The Parkinson's scenario in particular, that really does speak to how the brain is affected by it. And they do say it can soothe the savage beast, right? I mean,
yes.
Isn't that the expression?
Yes.
So
yes.
when it is calming and it does feel like it's decreasing your blood pressure, it actually is.
It is. It is. And it also decreases your respiratory rate. So the sound processing actually begins in the brainstem. So that's where your heart rate's controlled, your blood pressure, your respiration. And it also decreases cortisol production. It makes the body relax. And there's been published studies, 2016, where they actually played music in a surgical ICU, and it decreased heart rate, blood pressure, both systolic and diastolic, respiratory rate, and increased oxygen saturations.
That's amazing. Wow, everyone should be doing that. That's really something else. Now, it's interesting because I think there's some level, you can, correct me if I'm wrong on this, but I think there's some level of preference that's associated. I'm thinking of a scenario. My brother loves classical music, and I stayed at his place, and he played it at night to help him sleep. And it wasn't calming. It wasn't like Bach. It was like, the coyotes chasing the roadrunner kind of, going back to our first introduction to classical music, right?
Music. Oh yeah.
Yeah, absolutely. But I found it really annoying, but he found it calming, which is interesting, right?
Yes. I mean, when we talk about music and we talk about whether it be calming or stimulating, you really have to take preference into account.
Sure.
For example, I am in a rock band.
Wow.
And yeah, it's a little side project.
That's fantastic.
Besides teaching.
Yeah.
Yes, I've been a music. The reason I'm so interested in this, I've been an amateur musician my whole life.
Yeah, myself as well. As you can see, my little guitar back there. But
yes.
I've learned a lot already.
So it really talks about preference, also rhythm and the rate. I mean, if it is at a nice 80 beats per minute, that's going to help you slow down as opposed to a song that's at 120 beats per minute.
Right.
But that 120 beats per minute may help you with exercise, to motivate you to do exercise, to get you going.
Right.
So you can actually use music both to calm you and to stimulate you. And that's what the beauty is.
Yeah, no kidding. Okay, so as for using it in health and healing, is there some historical basis to this, or what can you tell us about when this started?
Yes, there is some historical. What we do know is that the first bone flute that was found, it was found in France and it was made between 20,000 and 30,000 years ago.
Goodness.
So we're talking, early in human civilization. And when you think about it, the person making it had to figure out how to blow into it, where to put the holes, and, so it encompassed everything of brain and development and muscle memory. There is some early work. They have just unearthed these letters from Bologna in the 14th century, where musicians would be sent to people's homes to try to help them with their melancholy and other diseases. Now, it didn't help, obviously, with any infectious disease process.
Sure.
However, the patient reported feeling better. And there's even a report in the 1700s. In 1871, John Jackson, who was a British neurologist, actually used music to help a child speak. The child couldn't speak, but could sing the words.
That's amazing.
And so there's a lot of historical references to using music, maybe not directly in health, but still to bring that communal and that healing process.
Isn't that fascinating that he couldn't speak, but he could sing?
Yes.
And we know there are several cases of people who have severe stutters, but when they sing, they're fine.
Yes.
That's
Yes.
always, that has certainly arisen. Mel Tillis being one of them, if I remember correctly. So I know it's been used for neurological conditions. So can you talk more about that piece?
Okay. So as I mentioned before, there's been a lot of work in Parkinson's in helping patients with Parkinson's to move at a regular rate and to lose the tremors. And multiple studies have shown that it improves gait, it improves stride length, cadence, and velocity with the cueing. So it's almost like the brain just is like, oh, okay, this is the rate and rhythm I need to be walking at. And that becomes the rate and rhythm the person walks at, which is amazing.
It is.
And it also has shown to improve mood. We know with Parkinson's that there are some mood swings and mood issues, and whether it's because of the dopamine or just because having a chronic illness. But we have seen where it has helped with mood. So there was a study published in 2020 that when a person with Parkinson's deemed the music as pleasurable, they had a much higher improvement in their gait than when it was just like a steady monotone, like a metronome, or unpleasant music. Also, it's been used in patients with Tourette's to decrease the tics, and it's both self-reported and observed.
Wow.
And finally, in children with autism, there's been some small pilot work that has demonstrated a decrease in their stereotypical behaviors and compulsive behaviors.
That's really interesting. So it obviously, when you talk about how it can alter a mood or help alter a mood, it can also help people express a mood, I'm assuming as well. I'm just thinking of times when I'm thinking of teenage angst. I think we've all had it, but there were times when you were feeling certain things, and if you played the music, it helped you work through the mood as much as it did, as much as it has the power to change a mood. And I'm sure that's why there's a lot, why angry music is popular with people who are angry, because it helps. Am I going down a rabbit hole here?
No, you're not. But we have to be careful, because when we think of some music that we might consider angry, like thrash metal and that really, 200 beats a minute, if you look at the words to that also, it is not, it's anger, but it's not, it's more, it's not an anger at a person. It's more helping the listener release their anger.
Right. Okay. Got it. Yeah, that's fantastic. I mean, the power that it has is amazing. I've already learned so much about this. What about degenerative diseases like Alzheimer's or dementia? Does it help with that?
Yes, it does. There have been multiple studies that have demonstrated it decreases agitation, some anxiety, depression in earlier stages of degenerative brain diseases, improves psychological symptoms. Early, it can actually boost cognition, memory, and motor function, along with quality of life. Now, that is early in Alzheimer's, in the degenerative process. What we do know is even toward the end of the Alzheimer's continuum or dementia continuum, patients still respond to music that they grew up with.
Wow.
They will start singing it or at least moving to it. And this is people who have no other who do not interact with their environment. So they're just sitting there at that severe end of Alzheimer's. But when they hear music of their generation, they start to sway to it, sing to it, move to it. Smiles come out on their faces. There's even a YouTube video, not that that's the best in evidence-based. However, it was a 98-year-old ballerina, Russian ballerina, and they played Swan Lake for her.
Oh.
And she had been totally disengaged. She started to move her hands in the way she would have danced.
Oh,
Swan
wow.
Lake.
Wow, that's beautiful.
Yeah.
Are there any theories? Go ahead. Sorry. Go ahead.
I'm sorry.
No, you carry on.
You go.
Okay. Are there any theories on why that's the case?
They feel that couple reasons that those memories are very, very still very deep in the brain, in the limbic system, the amygdala. So not in the cortex that's being destroyed, but very deep in what some biologists call the reptilian brain.
Okay.
That very deep, the amygdala, the hypothalamus, all those things that we need to live and breathe and survive. They also, with dementia, does not affect the cerebellum. When you look at dementia patients, their cell is not affected. What's affected is the connection between the cerebrum and the cerebellum. So that connection's gone, but the actual movement part of the brain is not gone.
Wow.
And there have been studies that have even demonstrated that music will calm patients with dementia better than any other non-pharmacological method.
Wow. That's really impressive. I was wondering if it had something to do with you mentioned that the cerebellum. I was wondering if it had something to do with the fact that we use every part of our brain to process it, that all of the other ones are still able to, on some level, to process, even if that communication isn't happening. It's fascinating.
Yes. Because, as I mentioned before, we're talking about the amygdala, the hypothalamus. We're talking deep brain structures.
That's incredible.
So, yes.
I know, you're a subject matter expert on a lot of things, and we're grateful that you are, but I know that your main expertise has been pediatrics, correct?
Yes.
Have you seen it used or practiced in pediatrics?
Yes, we do use it a lot. My background's actually in pediatric critical care.
Right.
So that's why the physiology is, I understand quite well. For distraction, during painful procedures or even getting blood drawn, some people will use it to help decrease nausea, just to kind of block the thought of that constant nausea, just to kind of like relax the patient.
Sure.
So we have seen it in that we've seen it in neonatal intensive care units, where if soft music is played, the premature infants, their heart rate decreases to a normal level, blood pressure is at an appropriate level, and especially someplace like that that's quite loud.
Sure.
But to have that calming music,
I
mean, and think about it. What do parents do to their newborn baby? It's one of the first things they do.
Sing.
They sing to them.
That's true. Oftentimes while they're pregnant.
Yes.
Right? There is that. I've heard that too, exposing the fetus to music or singing to the baby. That's really interesting.
Yes, it is. That we still need a lot more research on, but still the baby does hear the mother's voice.
Right. Wow, the research piece of it, doing the research must be fascinating for people that are involved on that level.
Yes. Yes, it's very fascinating.
Wow.
Little hard because, there is that subjective part of music.
Sure.
But
yeah. So what about pain control? Would it help with that?
There has been a number of studies that show adults in ICUs where listening to music activates actually both the mu receptors, so what we use for opiates, along with release of endorphins.
Huh.
So, obviously it has to be music that the person enjoys.
Sure.
But it can really increase the sense of pleasure, decrease the sensation of pain, can cause decrease in release of all the stress hormones that you don't need to have running around when you're in the ICU. And that decrease in cortisol levels will last a little while. So it's not just immediate while you're listening. It will last a little while. And there was actually a meta-analysis done not too long ago. I actually personally know one of the authors, and they looked at all the research out there, and in this meta-analysis, they actually demonstrated that 20 to 30 minutes is the golden amount of time to listen to music to help with pain. Less than 20 minutes did not significantly change the pain scores, at least in the studies that they looked at.
That's interesting. And that's not to say that you stop at 25 to 30. You can continue, but you need to get to that point, is what you're saying.
Yes.
Right.
Yes, you need to get to that point.
Right. So this really speaks a lot to nursing intervention when you think about it. Even, if you have a patient who's intubated, you can ask family members what their favorite music is. And it doesn't have to disturb the masses. If you had, earbuds or something and tested the volume first, of course, goodness, we don't want to blast them out of the room. Yeah. But that's fascinating.
And think about it with childbirth.
Sure.
Mothers are encouraged to listen to their favorite music, bring what, calms them.
Right.
So, it's being used, and we know it works. It's just now the research is catching up with what we've been doing for a very long time.
Yeah. It may even, of course, this is entirely theoretical, but it may even help the baby through the birthing process if it's music in the room. Who knows? I'm just throwing stuff out there because that would be a really hard thing to figure out.
That would be.
Hard to be subjective with a newborn.
Yes.
And they're going to cry regardless. So there you go.
Yeah. Well, and we want them to cry.
Yes. Oh, yes, we do. Maybe we should play music they don't like. No, I'm kidding. Sometimes bad music can make me cry. So there you go.
Just kidding. Oh, yes.
Again,
True.
it's perception. One person's great calming music is another person's not so much. That is all the time we have for episode 1. We hope you will join us for episode 2 as we continue our discussion on the culture and history of music and take a deeper dive into how music is used to treat traumatic brain injuries and other mental health disorders. This is Leanna McGuire for Elite Learning with Calibri Healthcare.
This podcast featured content from an accredited CE activity provided by Calibri Healthcare. Visit elitelearning.com/podcasts for accreditation and disclosure statements and instructions on how you may be able to earn CE credits. Take your learning to the next level by subscribing to more podcasts on compelling healthcare topics.